Hello, I'm Dr. Stalin Ramprakash. I'm one of the pediatric hematologist, oncologist and bone marrow transplant physician at Aster CMI Hospital, Bangalore. Today I'm going to talk about thalassemia. Thalassemia is a genetic condition which is inherited, so these patients are not able to make red blood cells, and for that reason they are dependent on regular blood transfusion for survival. So they need to undergo regular lifelong blood transfusion, and as you give more and more blood, iron accumulates in your body, and hence you need to have regular iron chelation medicine that also needs to continue lifelong. In spite of all this treatment, over a period of time, the iron accumulates in the body, which affects multiple organs, including liver, heart, kidney, other endocrine organs. So they undergo a lot of medical issues over a period of time, usually after the age of 15 or 16 years of age. And their long-term survival is also shortened because of the various complications which can develop over time. So this is one way of managing the thalassemia patients, which we call it as a conservative treatment. The other type of treatment is what we call as a bone marrow transplant, where we sort of use one of the donors and use their stem cells to sort of introduce into the patient and make it work. And then eventually their body will be able to make their own red cells, which means they don't need regular blood transfusion or any long-term medications. In terms of who is going to be the donor, the ideal donor is either fully matched brother or sister from the same family. But nowadays the technology has improved so much that we can even do transplant with a fully matched unrelated donor, or even a half-matched transplant from a father or mother or one of their brothers or sisters, which is called haploidentical transplant. So now essentially every thalassemia patient have the opportunity to undergo bone marrow transplant, which was not the case maybe 10-15 years ago. But the most important point here is the bone marrow transplant outcomes are very good if you do the transplant at a very young age, which means ideally under 10 years, if you do the transplant outcomes are good and they will have a good long-term survival. Once the patient crosses, say 18 years or 20 years, then the transplant risk increases significantly. So even with a matched sibling, the risk increases. So the families need to be aware of what are the long-term outcomes of thalassemia without transplant, which in the current setting in India, it is about 25 to 30 years survival for 50% of the patients. That means at least 50% don't make it beyond 25 to 30 years. Whereas transplant, if it's done very early, they will have a long-term survival. For matched sibling, the survival will go about 95%. I will be able to answer any specific questions you have. So I am working in Aster CMI Hospital as a pediatric hematology oncologist, oncology department. Thank you very much.